All right, so just for its tissues, so I'm just gonna test you on epithelial tissue and connective tissue, okay? Just epithelial and connective. So know where they're located. So epithelial tissue is on, it's gonna be on top of body surfaces, right? It's gonna line hollow organs. It's gonna form glands. Okay, know the characteristics of epithelial tissue, okay? So again, the easiest way to do this, have your notes out and highlight it, because it's almost impossible to write everything that quick, okay? Or you just write epithelial tissue characteristics and just go look it up. It's all in the notes, you have all the notes, okay? It's in my book, in the lab book too. All right, so epithelial tissues, right? The cells are very, very tightly packed together with little or no extracellular space, okay? They're gonna be in layers, so a single layer would be simple, two or more layers is stratified, okay? And remember, epithelial tissue is avascular, it means it has no blood supply, it's avascular, okay? So it has no blood supply, but it does have a nerve supply, okay? It does have a nerve supply, okay? Epithelial tissue has a very, very high mitotic rate or cell division rate because it's the only tissue that makes contact with the external environment. So a lot of wear and tear, right? A lot of wear and tear. Okay? So epithelial tissue is connected to the underlying connective tissue by a basement membrane. Okay, this is by a basement membrane. Okay. All right. And again, we name it by the shape. So a single layer of flat cells would be, right, simple squares. Two or more layers of flat cells, stratified squares. If they're cube shaped, right, cuboidal. If they're long, columnar. Okay, if they look like it's multiple layers, it's pseudostratified. Okay, in transition will change the shape. Right, so connective tissue, right, we're going to have fibers, cells, and ground substance, okay? Right? So connective tissue does not make contact with the external environment, okay? So know the types of connective tissue, right? So bone's a type of connective tissue, right? Ligaments, tendons, cartilage, okay, fat, right? Adipose tissue is connective tissue, right? And then blood and lymph also. Blood and lymph also connective tissue. Okay, blood and lymph is connective tissue also, okay? Okay. Let's see. Cartilage will be on the lab test. Cartilage will be on the different types of cartilage, and the different types of membranes will be on the lab test also. Okay. All right. So now what we're in, we're to bone tissue, right? No, skin. Gotta do skin. Okay. So the top layer of skin is going to be the epidermis, right? It's above the dermis. It's going to be made up of epithelial tissue. Okay, so it does have a nerve supply, but it has no blood supply. Okay, know the cells that make up the epithelial tissue. Okay, so keratinocytes. Okay, makes keratin. Cells that make the keratin. So keratinocytes. Okay, melanocytes. Those are the cells that make melanin. Okay, those are the cells that make melanin. Going to protect us from the sun's ultraviolet radiation. Okay, Langerhans cells. Langerhans cells fight infection. Right? They work with T cells. Okay, so Langerhans cells work with T cells, help us fight infection, and then Merkel cells hook up to a Merkel disc. Okay, hook up to a Merkel disc. Okay, and that's for sense of touch. That's just touch sensation. Okay, so for the lecture test as well as the lab test, know those cells. Okay, for the lecture test and lab test, know the layers. Know the layers of the epidermis. So the deepest layer, right, the single layer cells, cuboidal or columnar, right, single layer cells. Okay, it's going to be the stratum basale, stratum basale. Then you have 8 to 10 rows of stratum spinosum. Above that, you have 3 to 5 rows of stratum granulosum. So the granulosum, it looks grainy because you're making a keratin now, right? It's a waterproof protein. So you're making a keratin in the granulosum. Okay, in the palms of the hands, soles of the feet, right? You don't have any hair there, but you have an extra layer. Okay, you have 3 to 5 rows of stratum lucidum. Just think it's translucent, okay? stratum lucidum, and the most superficial layer, the top layer, is the stratum corneum. Okay, it's 25 to 30 layers of dead cells filled with keratin. Okay, all right. So know the dermis layer. Okay, so the very top layer of the dermis is the papillary region, right? Mostly elastic connective tissue. Okay, and then the deeper layer of the dermis, okay, the reticular region, is dense irregular connective tissue for the most part. Okay, there's some fat in there, right? It's a lot of blood supply in the dermis, right? A lot of blood supply. Okay, and we're going to have our hair, root, and follicle in the dermis. Okay, in the dermis. Okay, and that's the nerve supply. It's that too. Okay, so in the upper layer of the dermis, right? Okay, we have Meissner's corpuscles. So corpuscles of touch. We call Meissner's corpuscles or corpuscles of touch. Okay. Okay, in the epidermis, we got the Merkel cells, right? Hook up to Merkel disc for touch. And then the deep layer, right? The deepest layer of the skin is the hypodermis or subcutaneous. We have Pacinian corpuscles. Those are for pressure. Pacinian corpuscles are for pressure. Okay? All right. Okay, so know the glands. Okay, so sudoriferous glands are what? Sudoriferous glands are sweat glands. Okay, you know those for both tests, right? We're going to give you another review for that test. We'll do that next week. Okay, so we have sudoriferous glands or sweat glands. Okay. Sebaceous glands or oil glands. They hook up to the hair follicle. So sebaceous glands or oil glands. Okay. And then ceruminous glands, right? They secrete cerumen. Okay, cerumen. That's earwax, right? Okay. Or ears. And mammary glands are modified sweat glands. Okay, mammary glands are modified sweat glands. Okay, and they secrete milk. They secrete milk. Okay, in the subcutaneous region, right? The subcutaneous region is going to be areolar connective tissue and fat. Any place you see fat, you're going to see areolar connective tissue. It's going to support the adipocytes. Okay, the fat cells. All right, let's go into bone tissue. Okay, so know the parts, okay? Remember the long bones? Okay, so the parts of the bones now. Okay, so the ends of the bones, you have a proximal end, right, close to the shoulder, okay, and a distal end, okay? It's called the epiphysis. So the ends of the long bones are called the epiphysis, right? It's a picture in the notes, the epiphysis. The shaft, right? The shaft is going to be diaphysis. It's exactly how I was going to ask you. What are the ends called? What's the shaft called? Okay. Very important, right? Where the epiphysis and diaphysis meet. Where the epiphysis and diaphysis meet, okay, that's going to be called a growing bone, okay, right? Bone's growing in length, right? Immature bone or growing bone, that is going to be called the epiphyseal plate or growth plate, okay? The epiphyseal plate or growth plate, okay? Okay. What surrounds the bone? It's a membrane, right? What surrounds the bone? It's called the periosteum. The periosteum. This is where ligaments and tendons attach to. Right? You have an outer fibrous periosteum and an inner osteogenic periosteum. Okay? The outside part's dense irregular connective tissue, so ligaments and tendons attached there. Okay, so ligaments and tendons attached to the periosteum. Okay? Okay, in the shaft, we have yellow bone marrow, and on the ends we have red bone marrow. Okay, what lines the shaft is that endosteum. Again, osteogenic cells there. All right, so know the cells. Okay, so osteogenic cells are the stem cells. They divide into the other cells. Yeah, genesis means to make, right? So osteogenic cells are the stem cells. Osteoblasts, just like fibroblasts, they lay down the matrix. Okay, the only difference is it's got calcium in it, so it's hard. Okay, so osteoblasts lay down bone. Osteoblasts lay down bone. Osteocytes maintain the daily activity of bone. They tell the other cells what to do. Okay, so osteocytes maintain the daily activity of bone. And osteoclasts, right? Osteoclasts break down and reabsorb the calcium. So they break down and reabsorb bone. Okay, so osteoclasts break down and they're going to reabsorb the bone. Okay? All right. All right. So, there's two ways that we make, bone, right? Flat bones, intramembranous ossification. Think you have the membrane, and that membrane turns hard, okay? That's flat bones, like your skull bones, your sternum, okay? Then we have endochondral ossification. Conch means cartilage, right? It goes through a cartilaginous phase. That's how we get bone growth and length, okay? All right, so know the fractures. Okay, so if you have a fracture and it doesn't stick out the skin, okay, it's a simple or closed fracture, right? Simple or closed. If you break it and then it sticks out the skin, okay, that's called an open or compound fracture. Open or compound fracture. Okay, what's a fracture in a little kid? Green stick, right? Can't break a green stick in half, right? It's too rubbery, right? Little kids are rubbery, okay? And if it's broken in multiple, right, it's like shatters, right? Comminuted. All right? Don't worry about bone healing for now. With skin, don't worry about the rule of nines, don't worry about the cancers, don't worry about the burns. Okay, that's more for your pathology classes, okay? All right, let's see. Let's see. I guess that's it for that chapter, right? Okay, let's see, let's go into the last chapter. Okay, so remember, there's 208 bones in the body, 208 bones. Is it an adult?
206?
I'm sorry, 206. What did I say?
208.
Oh, sorry. I think I'm having little strokes. I don't know. Okay. Anybody lose a butterfly pin? It's what's in the pin. So 208 bones in the body. Okay. So we have. I said it again. Next time I say it, throw something at it. Where's 208 come from? I don't even know. All right, 206. Okay, bones. It's on a test. Make sure you know that. I don't want to screw anybody up. All right. So we have the axoskeleton and the appendicular skeleton. Axoskeleton is the skull, vertebral column, ribs, and sternum. The arterioscles, don't worry about those. We'll get those next semester. Okay. And the hyoid bone. The hyoid bone is the only bone that doesn't make contact with another bone. Okay. All right, so the exoskeleton, we're testing on this test. Appendicular will be test 2, test number 2. We'll do that next week. Okay? All right, so know the bones in the skull. So and I'll ask you just like this, what's the most anterior bone in the skull? Frontal, it's in the front. What's the most posterior?
Nasal.
The most posterior? Occipital. Nasal is your nose. Okay, so since we're on it, the occipital bone. I want you to know 3 types of framing, right? So, what's the big hole in the occipital bone? Right? It's a foramen magnum. Magnum means big, right? Means big hole. So foramen magnum. Okay? Foramen magnum's located in the occipital bone. The hypoglossal foramens in the occipital lobe, and the jugular foramens in the occipital lobe. Okay, hypoglossal nerve, cranial thing goes through there. Don't worry about what goes through there, you get that next semester, we do nerves. Okay, jugular foramen, get that when we do blood vessels, okay? That's gonna bring the jugular vein goes through there, brings deoxygenated blood from the brain down to the heart. Okay, all right, so now, the 2 top bones are called what? The parietal bones, right on the top, okay? And then the bones with the ear hole in it. Bone with the ear hole is temporal bone, right? So you got your temporal bone. The ear hole is called the external auditory meatus. Right, so the external, auditory means hearing, okay? And meatus is the long tooth. So on a multiple choice test, it's pretty simple, okay? And remember, that little bump in the back's the mastoid process. Okay, it's muscle attachment, it's still kind of mastoid muscle, we'll get that with the muscles. And then, got a little thing that looks like a stick or a steak, right? That's the styloid process. Okay, the styloglossus muscle originates there. And we'll get that with the muscles, muscle of the tongue. Okay? All right, let's see. So what are the cheekbones called? Zygomatic, right? Zygomatic bones. That's exactly how I'll ask. What are the cheekbones for? Okay? Okay, what's the bone that houses the top teeth? Maxilla, good, right? It's actually two bones that are fused before you're born. Okay, what bone houses the bottom teeth? Mandible. What are two foramen in the mandible called? Mental foramen, good. Got the mandible, you got the mental foramen, good. So, the mandible and the temporal bone make a joint, right? So you open and close your mouth. That's the temporal mandibular joint, it tells you. Okay? Okay. All right, so now in our nose cavity, in our nasal cavity, we got these ridges. Okay, the ridges are called nasal concha or turbinates. Okay, I give them two names, concha or turbinates. Those structures are part of the ethmoid bone. Okay, the ethmoid bone sits in back of the frontal bone. So the ethmoid bone, okay, the structures in there. You're gonna have the cristagalli and cribiform plate. Remember, right? Cristagalli separates like a septum. It separates the two sides. Okay, cribiform plate has holes in it. Right, has holes in it. Okay, those holes is where cranial nerve 1 goes through, olfactory nerve. So don't worry about that now. Okay, so the ethmoid bone has the cristagalli, cribiform plate, and nasal concha. Okay, those are the three structures that make up the ethmoid bone. Right. Then we have the sphenoid bone. Right. It looks like a butterfly. Sphenoid means wing. Right? In the textbook, it was green, right? It was green. The pictures were green. The nose. Okay. What's important about the sphenoid bone? What makes up the sphenoid bone? You got your sella turcica, right? Sella turcica is where your pituitary gland sits. Okay, it's where your pituitary gland sits. Right? And now, the sphenoid bone makes up your eye orbit, the posterior eye orbit, right? So, posterior eye orbit. Right, you have these long slits, okay, they're called fissures. So I have a supraorbital fissure, right down it, supraorbital fissure on top of the orbit. Then you have an infraorbital fissure, right, so underneath that, okay, and you have an optic foramen. So those two fissures, right, cranial nerves 3, 4, and 6 go through there. Don't worry about that now, we'll go next semester, we do nerves. Okay, but it innervates the muscle that moves the eyeball around. Okay, then you have an optic foramen in there too. That's where cranial nerve 2 goes in. That's for sensation of sight. Okay, we'll do all the cranial nerves next semester. Okay, so superior and inferior orbital fissures, optic foramen, okay, and sella turcica, or all in the sphenoid bone. All in the sphenoid bone. Okay, so let's look at the fissures. Okay, I'm sorry, the sutures. Okay, so the sutures, right? We're going to fuse those bones together. So the suture that separates the frontal and parietal bones, right, separates the frontal and parietal bones, is called the coronal suture, because it's on a frontal or coronal plane. Just think, a coronal, means crown in Latin, okay? A crown, it's on your head, okay? So that the coronal suture separates the frontal and parietal bones. The sagittal suture separates the two parietal bones, right? It's on the sagittal plane. Okay, it's on the sagittal plane. So sagittal suture separates the two parietal bones. Lambdoid suture separates the parietals from the occipital. Lambdoid separates the parietals from the occipital. And squamous suture separates the parietals from the temporal. Okay, squamous suture separates the parietals from the temporal. Do not worry about the fontanelles. We don't really catch on those. All right. Let's see. All right. So how many cervical vertebrae do we have? 7. Right, 7 cervical, good. How many thoracic? 12. How many lumbar?
5.
How many sacral?
4.
5, but they're fused to 1. So they're going to be fused by the time you're a teenager. Coccyx 3 to 4 are also going to be fused by the time you're a teenager. Okay? Don't get those wrong, I'm a chiropractor. All right? Okay. Know the curves. Okay, so our primary curves, you get that when you're born. The primary curves are chi-theta curves, right? Chi-theta curves. Okay, so primary curves are chi-theta curves. The it's gonna be your thoracic region and your sacral region. So primary curves are kyphotic curves, and the examples are gonna be the thoracic and sacral region. Okay, your secondary curves, right? The baby puts that in, those curves in. The secondary curves, they are called lordotic curves. So secondary curves or lordotic curves, okay? And those examples are gonna be cervical and lumbar region, cervical and lumbar, okay? Okay, so the square thing in the front, the square structure in front of a vertebrae, those are the bodies, okay, vertebral bodies. What shoots out the sides, transverse processes, right? Something that sticks out. And in the back is the spinous process, So the big hole in back of the bodies, that's where your spinal cord is, okay? And when the vertebrae stack, they make holes on either side. Okay, those are the intervertebral frames. So vertebral framing, the big hole where the spinal cord is. Intervertebral frame is where the spinal nerves come out. And they're gonna branch into peripheral nerves there. Okay, in between the bodies, okay, we have shock absorbers. Those are called intervertebral discs. Okay, for short, we just call them vertebral discs. Okay, the outer portion of a disc, okay, the outer portion of the disc is gonna be called the annulus fibrosus, round fibers. So the outer portion of the disc is the annulus fibrosus. Inner portion, that inner gel, okay, nucleus pulposus. The inner gel is the nucleus pulposus, okay? All right, so if we're talking about ribs, right? Ribs 1 through 7 are called what? Ribs 1 through 7 are true ribs. 8, 9, and 10 are false ribs. 11 and 12 are floating, this is floating. So 1 through 7 true, 8, 9, and 10 false, 11 and 12 are floating. So the ribs are gonna articulate with the vertebral column in the back, right? And posterior. So, okay, rib heads articulate with the vertebral body, then they swing up and the rib necks articulate with the transverse processes. So rib heads articulate with the vertebral body, rib heads articulate with the transverse processes. And they go at an inferior angle and they wrap around the front, okay? And they're gonna make contact with the rib cartilage, which is called costal cartilage, and that is made up of hyaline cartilage, right? And the place you find hyaline cartilage is at the end of the bones that make up the joint. Okay? Okay, so the sternum, right? What's the top portion of the sternum called? Right, the superior portion of the sternum is the manubrium. Then we have the body, and then the inferior portion, xiphoid process. So the superior portion of the sternum, manubrium, there's the body, then we have the xiphoid process, that's covered with cartilage. Okay? So the bone that doesn't make contact, the bone that's superior to the manubrium doesn't make contact with any other bone, that's your hyoid bone. Okay, we see that's for muscle, tendon attachment, and ligamentous attachment. All right? And that is it for test number 1. That's good. I'm not gonna start new stuff today, we'll start that next week. All right? And that's it. Have a good weekend, unless you have labs. We'll see you in labs. All right? Let's see, let me, go through attendance real quick. So Berna, come in.
Here.